I think this is a very difficult decision for any woman that chooses to have breast augmentation surgery. You're being asked to pick a size for the implant without being able to try it on, and that never goes well to be able to pick out a dress size without trying it on. Fortunately, there are some good ways to help you with that. One of the things I suggest is if you have an after or before and after picture that you really like, that you've seen somewhere out there, you bring that in, and I can get you pretty close to that. We can never get you exactly, but we can get you pretty close to that. And that'll give you an idea of how the breast may look on a particular woman's frame, and if that frame matches you, you can get a good idea of how they'll look on you. The second thing is something called the Rice test. A lot of people think that doesn't work so great, but that is another way that you can try, and it may work well for you. And if you go to my website, there's detailed instructions on how to do that. The last way that I tell patients is if you like Victoria's Secret's bras, go to Victoria's Secret's, let them measure you, and let's say you fit into like a 32B or a 34B. Stay in the same chest size, 32 or 34, and try on a 34C, 34D, and if you're really in the mood or crazy, try on a 34 double D. And keep in mind, they make their bras a little bit smaller than other people so that their D cup is like a C cup everywhere else. But if you find a bra that you go, you know, this is about the size that I want to be, let me know that size and I can get you close to that. Having said that, one of the most common problems after surgery, or issues that women have after surgery, is that they're unhappy with their size and they wish they would have gone a little bit bigger. So I tell women, first, if you're on the fence, choose the bigger size, because so many women wish they would have gone bigger, and you may even have friends that say that to you. Also, it's important to keep in mind that if you do choose to go bigger after you have your initial surgery, that surgery is extremely simple with very minimal recovery. I usually do it with the patient awake, which means we put an IV and give you medications to help you relax and numb the part that I need to work on you. We simply remove that implant and put a new implant in. So the recovery, you're looking at maybe a day, maybe 2 days. Most people can go back to their activity within a few days. The pain isn't there, the discomfort's not there, the swelling's not there, the cost isn't there. So it's just a very different operation to switch out that implant. And it's important to keep that in mind so that you're not overly stressed about this decision.